Welcome to the UroShield application hands-on. The UroShield is intended for use with indwelling urinary catheters and is addressing the two major problems associated with these catheters: urinary tract infection due to biofilm formation, as well as catheter-related pain, discomfort and spasm. The UroShield can be used with Foley catheters of different kinds: silicone, latex or Teflon coated latex, or any other materials that are either for urethral or suprapubic application, at sizes between 14 and 22 French. Please note, the insertion and removal of catheters should be performed only by qualified medical staff and in accordance with the relevant medical facilities care guidelines. Let's take a look at the UroShield box. The box comes with the electronic driver that actually controls the therapy. We have here the disposable Euroclip that is applied on the catheter and allows 30 days of protection. We've got the adapter, AC adapter for the charging the unit and activating it, and the manuals, the user manual and the quick guide instructions for use. Please note that the UroShield should only be installed on a newly inserted urinary catheter, so it is recommended that the UroShield installation is scheduled immediately following catheter replacement. Also note that the UroShield should not be used to resolve or treat an active urinary infection. So now we have the catheter inserted in place, and we are going to start the UroShield application. Of course, always important to use gloves while performing these procedures. And we will start by gently pulling on the catheter until we feel slight resistance, meaning that the balloon is hitting the bladder wall. Then we will take the actuator out of its packaging, release it, and remove the two liners that cover the adhesive on both halves of the catheter actuator. Then we will clip it over the catheter on the external part with the wire going towards the patient, about 3 fingers, 3 to 4 centimeters in women, in females, and about 4 fingers, 5 to 6 centimeters from the male organ in men. We will have the catheter go along the 2 grooves here, and we'll snap it close, watching out not to pinch the catheter. As we finish that, we will take the driver and we will plug the actuator plug into the unit driver connector and push the on-off button for about 2 to 3 seconds until we hear a short beep and the driver will turn on. It will start with initiation process, and while this occurs, we will take the charger, plug it into the mini USB socket here and plug it to the mains wall. The driver display shows the status of the battery and the actuator connection. After about 3 minutes, the display will dim and it will show a screensaver that will scroll on the display. Please note that when the screensaver is displayed, you can return to the battery actuator status screen and brighten the screen by pressing the on-off button shortly, like this. The UroShield driver works intermittently in cycles of 15 minutes active followed by 5 minutes idle. You can hear a low hum sound from the actuator during the active period. Important note, the UroShield should be active continuously, 24/7, except for the time when the patient needs cleaning. So keep it connected to the mains during all times, and for portability, the patient the device may be disconnected from the mains, and it has a battery that will allow it to work for about 6 hours. When the charge in the battery goes down to about remaining half an hour, the unit will start alerting by audible beeping and with a visual display, blinking of the battery, showing that you have about half an hour until you need to plug it back to the wall. Full charge, recharging, will take about 1.5 hours. Cleaning the patient. The UroShield driver is not waterproof and should not be exposed to water. Before cleaning the patient, you have to disconnect the unit by turning it off by pushing the on-off button. Then pull on both sides of these connectors to disconnect it. Do not pull it against the unit, but between those two connectors. After disconnecting it, you can go on with the patient cleaning, and after cleaning is finished, the actuator and wire should be dried using a towel, then reconnected and reactivated. Please note, the actuator is designed for single use only. That is, for use with one catheter. Each actuator will work effectively for 30 days. The actuator must be disposed of together with the catheter after removal, and a new actuator should be installed on the newly inserted catheter. Thank you.